Hi, it's Dr Shahzadi Harper here of the Harper Clinic. Welcome back to our coffee and chat. Today we are going to talk about contraception in perimenopause. So if you've got any questions, and I've got a few here already listed, then do fire away. Okay. Hi Meg.
Hi guys.
How are you?
I'm fine. How are you?
Really
it's very
good.
hot, isn't it?
I know. Look, can you see the sheen?
Yeah, the sheen. Yeah, you look gorgeous on that.
No,
sheen.
no, that's the sweat. That's sweat is what I'm saying. That's the sheen.
The dewy look. The dewy look.
Thank you for that. But
the absolutely dewy look. Yes, let's put a little filter on me now.
I've been watching your progress with your training. You're looking very good and healthy.
Thank you. Well, yeah. I mean, it's really good because, like we said, you lose X amount of muscle, don't you? And I just think it's. I don't know if I'm going to be fitting in any of my jeans because of my bottom has seemed to decided to just go like that for some unknown
reason. It's looking
reason.
good. I saw that in your yoga bottoms, and I thought, gosh, she's got a good bum there.
For that. So I don't know what we're going to be doing because everything's got a lot muscular. Yeah, it's good and I feel good. I just haven't really tried on sort of normal clothes yet.
No, well, you look strong. You look really
strong.
Yes,
I look strong. I know. Yeah, I feel strong. Do feel strong, and I feel very healthy. And mind-wise, I feel better than ever.
Oh, fantastic!
Doing it. And that Richie Swan, I mean, he does it free for 14 weeks every day at 10.
I think I'm going to have to do that because you're only seeing me from this bit upwards. And below, the lockdown, the lockdown has taken its toll, sort of a little bit below here. So, yeah,
I think it was on everybody. Yeah.
I had one question from Sabrina, and Sabrina, I hope you don't mind me saying. You said that you're 43 years old, and will the Mirena Coil help in perimenopause or menopause? So I think maybe what I'll do is to just do a little recap about contraception in perimenopause, because I think it's really important, because I think a lot of women think once we get into our 40s that maybe we don't need any contraception, maybe our fertility is declined enough that we don't need it, but actually 1 in 100 women at the age of 50 get pregnant. Now, I know it's only 1%, but it was still quite a lot more than even I had anticipated in some ways.
You know what? And I have 2 friends that at the age of 50 have both had triplets. And you know one of them, don't you? Carolyn. So, you know what I mean? And then I have another friend as well from Brighton. She had triplets at 50 that she just popped out 3 eggs one day.
Yes.
And same with Carolyn. So that's weird that within our little circle of women, that's 2 women. So, you don't really want to be having, I mean, other friend of mine, Brighton, she's got 10 children.
Oh, goodness. Well,
no, she's 54 and she works in the city, and she's so like, no, but she's like, probably she's a career woman.
Yeah.
She's up in London all the time. I see her out and about. She does big talks for like Coots. And one child at 40 and one at 4.
Well, I mean, I think that's the thing, because periods become irregular. Cycles become shorter. We may miss a period here. We may have 2 in a month. I think women presume that maybe we can't get pregnant anymore. However, what can happen is sometimes some of these periods may be what we call anovulatory cycles, where there's no ovulation, but then at other times you may just get, sort of more than 1 egg being released, as your friends did. So it's important to understand, ladies, that we still need to have contraception in our 40s. It's the highest age range where, terminations are happening. And it's also a high risk time for women. If you are considering getting pregnant in your 40s, it's a high risk time for women because of diabetes, blood pressure, and also from the baby's perspective, fetal abnormalities, Down syndrome. So you do have to consider all of these things if you are considering pregnancy as well. So Sabrina asked about the Mirena Coil, and the Mirena Coil is a really good form of contraception, and it lasts for contraception, it's licensed for 5 years if you're under the age of 45. If you're over the age of 45, then you can keep it in for contraception purposes for 7 years. However, if we're using it for HRT, then just remember the number 5. You've got to get it changed every 5 years. You've got to get it changed. And Mirena is quite good in your 40s because a lot of women might have heavy periods as well as being perimenopausal.
I had it for 10 years. I mean, I changed it, but and I was one of those lucky percentage that I didn't even bleed.
Yeah, so 50%.
Yeah, I was one of those which never bled. Well, that's one of the reasons I didn't know that I was like perimenopausal or menopausal, because because that's when I went and said, look, you can take it out now, will you please? Because I need to know whether my periods had stopped, and they had stopped. But so I'd had no idea what age that they stopped. Was it 47? Was it 48? Was it 49? Because I took it out when I was the end of 49, 5 months before I turned 50. So I had no idea, you know, when my periods.
You make a good point that, you know, when you have got something like the Mirena Coil, which is a progestogen only form of contraception, or if you're on the mini pill or the implant, you might not know when you're menopausal because you may not have periods, you know, like you said, you didn't have any, and a lot of women don't. So that's the time, or the group of women that should request a blood test. If you think that you're perimenopausal, if you're getting symptoms, if you're feeling tired, if you're feeling, you know, sort of your mood is up and down, and you're worried about whether or not, you know, you're going through the change or the menopause transition, you are a group of women that should have a blood test, so the FSH test, because we need to know to sort of help and guide you. So you know, one of your other followers had said, if you have a Mirena coil and use estrogen patches, how long can you keep the coil in for? My GP said 3 years, but was not very sure. So I think we've sort of answered that when I've said, remember the number 5. It's 5 years, and then you must change it. You've always got to change it after 5 years if you're using it as part of your HRT.
Right, okay. Yeah, because that's what I mean. It's like, at least we talk about it more now, but I had no idea that all the symptoms that I was getting was part of peri or menopause, because for me it was just a hot flush and you didn't have a period. I didn't know about foggy brain, aching joints, not sleeping. So at least now, women, if you are starting to get those, which I was having before, but I just thought it was part of my lifestyle that I had many years ago. I just thought this was it's all coming back to, you know, bite me on the bum now, all these different ailments. But there wasn't anything really out there for me to read about, to say, by the way, you're not going to sleep, by the way, you're going to, you know, you're going to have aching joints, you know, you know, we all know that everyone would go, oh yeah, you're going to have a dry vagina and you're not going to have a period and you're going to be emotional. But all those other ones, you know,
even something like tinnitus, you know, tinnitus.
Yeah,
I mean, tinnitus can get worse.
And frozen shoulder, how weird is that?
Joints,
yeah, I mean, that frozen shoulder one, it just so weird that, like Pip, for instance, my friend, she had the frozen shoulder, and I was like, you know, it's the menopause, and she was like, really? And then we looked it up and we started looking at percentages, and it was you know, the more women. When I went to see my physiotherapist about my back, and she was telling me the percentage of women that come in for frozen shoulders, you know, in the menopause, it was like 80% of women that she would see would be because, you know, when they're trying to get in this, because I try and put my sports bra on and think, there just was no, like, couldn't actually get this right round anymore. Sort of goes like that. You know, you can't get full movement anymore. I mean, it's bizarre, and it's a tiny thing, but it's another major thing that we just go, oh, don't worry about it, just can't be
age. You're over 40, 45.
But you shouldn't have to be like that. No, so in your late 40s. So all these typical things we do not have to.
We put up with symptoms maybe that we're sometimes not so aware. And somebody's just said, put up, isn't it 4 years for endometriosis? So there's a story around the Mirena Coil that officially it's licensed for 4 years in the United Kingdom, 5 years in Europe. And that's the reason behind that, is because we just didn't continue the study for long enough. So technically we can use it for 5 years. but sometimes for endometriosis, we may shorten it a bit depending on the degree of endometriosis.
Okay.
So sometimes
Can you explain endometriosis for me?
So endometriosis is, so endometrium is the word that we give for the lining of the womb.
Okay.
Okay. So endometriosis is when you have that lining of the womb outside of the womb area. So you can bleed, and it causes painful bleeding, painful periods, heavy bleeding, and it can make it harder to have babies and conceive. So putting the Mirena Coil in, one of the beauties of it, why you don't get a period, is because it keeps that lining of the womb thin.
Ah, okay.
So it will reduce the symptoms for a woman with endometriosis.
And is it common, endometriosis?
It's more common than erectile dysfunction for men, yet less money is spent on the research.
Let's get that one in there for a change. Yeah.
So I just thought I'd mention it. It's much more common than that is, and yet, you know, less money is spent on women's well-being and health. And well-being for women is a charity which does a lot around it. So
okay, that's interesting. So if you just, you know, if you just have heavy periods, would it be something that you should go and look at?
Yes. So because sometimes it takes a long time to get to the diagnosis. So
yeah, because I have, you know, people that write in a lot about this.
So you know, a lot of women may have sort of heavy, painful periods, and an ultrasound scan will not diagnose it. You've got to have a hysteroscopy to get to understand. But you know, things that help to sort of slow your periods down, or don't make you bleed as much, help to alleviate some of the symptoms, like the Mirena Coil or having the pill pack run back to back. So that's one of the things. And sometimes women do get diagnosed with it in their early 40s. And you know, I've got a youngish patient who came in, and she's only just recently had she's had a hysterectomy because of endometriosis, and she's in her early 40s. So you can get diagnosed at sort of in your 40s. A lot of the time it's younger women. I mean, if you've got a daughter or a friend or somebody who's in their 20s, got really heavy, painful periods, she's had a scan and it's come back normal, think endometriosis and maybe go back to the GP.
Good to know.
Yeah. Okay. So somebody's also, one of your followers has said, I'm having a period, my first since November. Does this mean I'm still fertile or ovulating? Well, as I've just said, you know, you can in your 40s have irregular periods, and you can be ovulating, so you do need contraception. In a nutshell, if you are under the age of 50, you can stop using contraception if you've had 2 years without a period.
Okay, so you're saying 2 years. Okay.
Yeah. Under the age of 50. Under the age of 50.
Under the age of 50.
2 years without a period.
Okay, okay. You and 1 year over the age of 50. Okay, fine. Right. Yeah. Remember that. Yeah. Because I'm always telling everyone just a year, so I remember to
under the age of 52 years.
Yeah, no, I will remember.
I hope you've not been responsible for a few pregnancies.
Any pregnancies out there.
Okay, so I hope that's answered that one. Then there's another one that says, is going on the pill when you're perimenopausal more dangerous than taking HRT? I have regular periods, but still weight gain, lethargy, brain fog, and anxiety. I was on the pill for decades, and I was very well on it. And then my GP refused to prescribe it because of my age only. So age should not be a reason for you to come off the contraceptive pill, combined pill. Up until the age of 50, it's safe for all women, and you don't have to come off it because of age. But if you're a smoker, if you're overweight, if you've got any, you know, diabetes, heart disease, blood pressure issues, then it is better to change over to a progesterone only pill, or to HRT, or to, you know, a Mirena Coil. So then the combined pill is not a good, it's not good to continue. Yeah. And just to sort of reiterate, the difference between the pill and HRT is, one, the doses of hormones are much lower, and that's why HRT cannot be contraception, or cannot count as contraception.
Yeah, okay, fine.
And also the estrogen in HRT is 17-beta estradiol, which is the one that our body produces, where in the pill it tends to be at a much higher dose and a synthetic estrogen as well.
Yeah. Okay. So can you take both at the same time?
Yeah, so usually most women, if you need contraception, you'll be put onto the progesterone only pill and HRT.
Right. Okay.
Okay.
Yeah.
Not a combined pill plus HRT. But for those women who like the pill and who are perimenopausal and who also like or also need contraception, not like, need contraception.
Love sex.
Yeah. Is that there is a really nice pill out there called Clara, which I prescribe in perimenopause, which has that 17 beta estradiol estrogen that we've just talked about, and also acts as contraception as well. And it's a 28-day pill. Let me just see what this. Okay. So that's quite a good kind of sort of crossover time that will give you some benefits like HRT, but also contraception. So I'm just seeing what Nins Thomas has written here. I had 2 years without a period, age 43, then a heavy bleed for a week, and then nothing since for a year. Wow. FSH results last week are. Oh,
see that? I go.
Again, I need contraception? Thank you. I don't know what that.
Ask her to send it. Write again what your FSH was, if you can.
Sorry, because I can't.
The messages they vanish for us.
One.
If after 2 years and then you get that bleed, but I've had people write to me before about this, and you just have to say, just carry on, you have
go
that
and get checked
bleed.
out first of all. Go and get a scan done. Go and see.
Because you don't know that one bleed whether it is actually a period or it is just your body changing, or you don't know, do you?
Or make sure you're up to date with your smear. Could it be something to do with your cervix? You can still get cervical cancer. So all of those things. So if you are somebody who's not had a period for 2 years and there's no other reasons, for example, sometimes women don't get periods if you're sort of on eating disorders as well.
Disorders, and stress or whatever in your life.
Exercise, weight loss.
Your IBM. IBM that can really show. If you go below, you can stop having periods, can't you? So,
and if you are somebody with polycystic ovaries, that might also be a reason. So whilst I've said 2 years without a period under the age of 40 means that you don't have to have contraception. If you've got other medical conditions which may be causing you not to have periods, then you need to double check that first. Okay.
Yeah.
Sabrina said, I love it when a man joins in. Yeah, it's really good when men join in as well. It is really good. It's great when men want to sort of know more, and it's good to spread the word.
I know. I think like when people always go, I'm always like, it's not just your partner, it's your mother, it's your sister, it's your cousins, and then they all of a sudden, when you go mother and sister, they all of a sudden go, yeah, you're right. When you go your partner or your girlfriend or your wife, they go, yeah. But then when you say, yeah, but this is happening to your mother, this is happening to your sisters, and then they're all like, yeah, you're right. They get more passionate about it, compassionate, should I say, for some reason. Because then they think, I said, it's going to be happening to every woman around you. Like for me, for my dad, for instance, I talk with my dad now. My dad's just like, I never would have thought that I would be talking about the menopause with my daughter. Now it makes sense, things, when I'm like, I really just wasn't up for doing that, Dad. Instead of it having to be a whole argument, now he's just like, okay, I won't be dragging you for a 5-mile walk along the route, Meg. Get away with murder.
How was he? How was he when you kind of discussed it with him? How did he?
Well, to tell you the truth, I speak really openly with my dad. So
dads often don't even want to think that their daughters are having sex.
Yeah, but with my dad, I had to ask my dad. I said, look, I am going out with somebody, and he doesn't get an erection in the morning, Dad. Is that really weird? Is that someone in their 50s? Is that normal? And my dad said, well, look, Meg, I'm 75 and I'm very fine in the morning. So that's how we talk. And then he said, no, there's something a bit wrong with that person. Then I said, every morning never happens. And he just went, nah, that's not normal, Meg. And I just said, is it? And he said, well, no, not for me. He said, and I'm well into my 70s and every morning.
Yeah, and so I just want to say, if there are men watching and if you've got erectile dysfunction, it is important to go and see your GP, because it can be one of the first indicators of heart disease and diabetes.
Well, yes, and this person did have, we ended up in A&E because their blood pressure was so high they nearly had a heart attack and died. And so, you know, it was pretty bad. But that, you know, that was the sign, that's what one of the signs was. But for me, I was just a bit like, but then they ended up being, you know, like you said, their blood pressure was so high that the doctors were just a bit like, you know, you could actually leave now, you can't leave, you would have a heart attack. Your blood pressure is so high.
So that was a rapid intro into your relationship together then, wasn't it? You sort of kind of
that was a very,
fast-tracked it.
Yes, yes, it did indeed.
Are you still with that person?
No!
Okay.
No. Definitely not with that person anymore. No.
So Nins Thomas says, apparently FSH through the floor. So that probably means, are you saying, Nins Thomas, that FSH is through the ceiling?
Oh, yeah.
Because through the floor means, you know, you're still fertile.
Yeah.
You know, when it's high, above 25, you know, 50, like I had somebody whose FSH was 76, and she was still getting the odd period now and then. But it definitely means that you are you are menopausal. But if you're still having,
what does it start off like 29, 30? Is it?
No, I mean, it depends on which lab. So anything above 25 or depending or 30, depending on the lab, means that you are menopausal. Yeah.
And that's the other thing I just want to say. I'm not putting down at all the NHS, but they will not look as be precise as private, because they just basically go by certain tags, don't they?
Yeah.
Because they, you know, they have to do so many blood tests and stuff. I mean, that they're not going to, there'll be a bit of give and take between, I know this because when I did my cholesterol and stuff like that, they were like, no, it's sort of fine. But then when I showed a private, they were just like, no, Meg, no. We would count that as you need to be careful. You know, so they were like, no, you're fine there. So they do that. So, you know, always keep, you know, and you can always get a copy of your own results as well. You know what I mean? Because they can be, if you are a bit worried, I can't really say go to a private doctor. I don't want to say that. But if you are, then just do be mindful that the NHS, they do just go, you know,
and if you don't feel right, you know, do go back and get it tweaked.
Yeah.
You know, go back and read.
And ask them to read it a bit more. Yeah.
You know, because you know we all as women are individual, and we all need sort of slightly different fine tuning, is what I was going to say.
Yeah.
You know, to get us to that right point, but also to remember it doesn't happen overnight. It can take you know, sort of a few weeks, few months to get to the point that you feel good. And as you know, Meg, you know, sometimes things, you still have to keep changing things, you know, at 3 months, 6 months, life changes as well and evolves. And so we need to keep sort of reviewing.
Yeah, I mean, like up in my estrogen, you know, that I didn't know that you could do that, you know, this all the time, like you say. And also the thing is, women, we need to know that, you know, we talk about these are amazing, these things, but you still live on, you know, life's terms. So, you know, stress still does come in, and you still get a headache, and you still might not feel, you know, I mean, I feel really nauseous today, and I have done for 3 days, like really nauseous. Now, you know, I know that nauseous feeling was that nauseous feeling that I had like 6 years ago. So, you know, those hormones, that's what I am very, when it comes to one of probably my weaknesses is nausea. I feel nausea really quickly. So this is the sort of feeling I felt when I first started thinking, you know, what was going on. So now, and I've had that for 3 days, and it will pass probably tomorrow or whatever, but I just feel nauseous, and that's just something that happens to me. So, you know, like I'm saying, you know, when you take all these amazing hormones, you're still going to have days where we don't feel.
Yeah, and you may, like, for you it's nausea, for somebody else it's like joint pains.
Those people have migraines, and I just never have a migraine. I never have headaches. So I find that really weird when I speak to people and they just said, look, I had a migraine for 3 months, Meg. Yeah. But then I go, well, I had nausea for 3 months. They're a bit like, really? So we're all so different, aren't we?
Yeah, and somebody here has really written and said the same thing, that they've gone backwards and forwards, and it's really good that you're sharing that as well. And I say that to people, that if you go on to HRT, it doesn't mean to say you're going to suddenly be 100% okay, because you know, life has ups and downs. You know, you might have, you know, grief, loss. You know, there are times when you are more anxious because maybe a job interview or you know, relationship issue.
Children. I mean, there's always things all the time, especially now at this, you know, with COVID and stuff like that. You know, like you're saying, it doesn't, you know, it's not a quick fix pill. It's great and everything, but I still get, you know, ailments. I mean, I was aching as well, you know, and you still sometimes feel a bit achy, you know, it's just you know, but you just know that it's not going to be there forever. You know what I mean? You know that it passes, and you just think, right, I know what it is now. I know that it's that I'm not like, you know, going to turning, you know, I feel like I'm 90 and I, you know, had a good night's sleep and you wake up stiff as a board, you know, all these sort of things. It's good for women to know that, because I've had a great night's sleep, but I've woken up and I've got out of bed like, oh my God, I felt like I've, you know, done 10 rounds.
And I think it's all about getting in tune with your body and becoming aware of your body and understanding your own body. And it's the same thing I also say to women about examining their breasts.
Your breasts,
it's really important you get familiar with yours so that you know when something changes. So it is
and
really,
diet and drink water and drinking less alcohol and, like I said, smoking. I mean, everything goes. The healthier you are, the better you will feel. I mean, it's, you know, and I can't point that out enough, because, you know, if you eat sugar and carbs and cocoa and all this stuff, you know, your poor liver has to work so hard on getting rid of all of this. Do you know what I mean? And you will just generally, if you just drink, you know, I want to tell everyone to drink 2 liters of water a day. It's not that much, but you will see a difference. Hydrated your brain and everything is.
Well, I've downloaded an app to remind me to drink water.
Oh, have you? Oh, brilliant.
Yeah, because, and that was actually something from a patient. One of my patients came in and their phone pinged, and I said,
oh,
what's that?
Yeah, tell us what that app is. That's good.
And they said, well, that's to remind me to drink water. And I said, for a moment, I thought, really, do you need reminding? And actually, I thought, well, hang on, a whole day can go by, and you can be so busy. So I've done the same thing, and so I get this sort of splash noise that reminds me I should go and drink water.
What is it? What is the app?
The app is just called Drink Water.
Is that it? Brilliant.
That's it. It's exactly what it says on the tin. Drink water. And it just reminds you to do it. And even if you don't do it straight away, you might do it the next time. And I think it's a really good thing. You know, it just reminds me to do it, because I'd realised that I wasn't drinking enough. And especially in this heat, you know, this weather, you know, if you are traveling, make sure you take a bottle of water with you. You know, if you're traveling on the tube, you're going to have to wear a mask. You know, it can be really overwhelming, and especially if you're hormonal and you're getting the hot flushes.
And then you're hydrated. I mean,
and anxiety. You know, so it really, really does impact. So it's not as crazy as it sounds to say drink water to get the app. Drink water. There are a number out there, so you can choose whichever app you want. I just chose that one.
I think it's a good idea, because the reminder, she says, reaching for a bottle of water.
So another one of your followers wrote, can you keep your contraception implant in if you are perimenopausal? Yes.
Oh, okay.
Yeah. You know, you do need contraception. Obviously the implant needs to be changed after 3 years. So you know, as long as you can change it. Sometimes and with that, then you can have a top up of some estrogen if you are getting some vasomotor symptoms like those hot flushes, you know, night sweats. So yes, you can keep it in. Most women or most doctors will usually say at the age of 45, let's change you over onto a different form of contraception. But yes, you can keep it in, and occasionally, you know, also add in a bit of testosterone, so you can still have almost like a combination of contraception and HRT to get you through this perimenopausal phase. Most contraceptive methods are perfectly safe. The things that sometimes, you know, I often say to people, if you're using condoms or diaphragms, even though your fertility is declining, you know, how important is it for you to not get pregnant is the question I ask. Because
and also, like, you know, when, like, with using my lubes and stuff, just also, if you are starting to date as well, you have to also remember not just getting pregnant, but, you know, sexual transmitted diseases. You have to think about that. Until you actually know the person that well, you want to be better to be safe than sorry, because, you know, people are not very, I mean, in America, everybody carries their sexual, on their on their phones. So
I think it's a really good idea, especially when in a new relationship. Yeah.
Well, I know, because when I went there at Christmas, the girls that I was there with, they all have it on their phone. They just go, you know, have you been tested lately? And they go, yeah, up to date. There you go.
Okay.
Shows everything. I was like, oh wow, we do nothing like that in England, do we?
No, I think it's a great idea. I mean,
it's a really good idea. I mean, it says everything. They check you for absolutely everything, and then you're like, you know, gonorrhea.
One of the things I always get women to do, and men to do when they're changing relationships, is that, you know, just make it a standard, you know, to have an STI screen. It's not about,
I think so.
You know, whether or not you're infected. It's almost like a passport, like you just said. You
I
know,
think so. And they do in America. They all have it on their phones. It's just one of those things, especially in LA. It's like, it's just a, you know, you would show your partner.
And the other thing is, I think, you know, make sure you're up to date with your cervical smears, because a lot of women are going, you know, having new relationships. You know, the highest rate of relationship breakdown is between 45 and 50. And the other thing that I say is, sometimes, I know we talk about the HPV vaccine for younger women. I often do recommend it to women in perimenopause who have come out of long-term relationships, that you can still get a degree of protection from having the HPV vaccine done at this point, if you're embarking upon new relationships.
Yeah, definitely. Okay, yeah, I'm going to come and see you soon. I might be embarking.
Embarking on new relationships. Okay. Somebody else has said, hey, I'm 44 and think I'm starting perimenopause. What do I do next? I think one of the things to do is what you've just said, Meg, is all of those lifestyle changes. You know, really think about, you know, like you mentioned, alcohol, carbs, exercise.
Yeah, definitely. I think, start just, and then also I would go to my app, and then maybe with the tracker, the symptom tracker, you can start now. I don't know what's going on in my house. Symptom tracker, there's, you know, you can basically keep an eye on it, because like me, I would always forget, you know, to write things down. And then you think, oh, did I have a migraine? Did I feel depressed? Did I feel like that? Now it's so easy. It's just emojis and yes, no, yes. So that you can then track it and then go back and look just for yourself, just to know.
Because when you're on a good day, you forget all of those.
You forget everything, don't you?
Yes, like and you think, oh, I'm feeling great. But then when you're on your bad days,
you just, you just feel like, oh my God.
So I think it's important to sort of note when how you're feeling, what you're feeling. I'll just answer this from Laura. I'm 54, had coil in for 7 years. I was supposed to have this taken out, but lockdown happened. I have been given HRT over the phone and been on it for 4 weeks. Wow, what a difference. Laura, depends what coil it's. If it's a copper coil, that can last for 10 years, and that won't affect any of your symptoms. So if you're getting symptoms, they probably are perimenopausal. And she said she's been given HRT over the phone for the last 4 weeks, and she feels amazing, which is how you should feel. You know, once you start again, you should feel the symptoms improve a lot. Okay. So GPS prescribed an estrogen gel to start with and an oral progesterone. Is that right? Yes. You know, so if you've got estrogel, you can either have oral progesterone, you can have the Mirena Coil. You know, either of those can work alongside the gel. So both either of those can be suitable. I'm just going to look at another question. I think that's all of them, actually.
Was it all of them that came through? Have we got any other ones there?
Let me just have a quick look. Yeah, I think those are all of them. I'll have another look just to make sure. No. So no, I think that's all of them there. I think we've answered most of them. Yeah.
So should we do, I was thinking next week, should we talk about cervical, get smears and stuff? I think so, because I think it's one that doesn't really get talked about. I mean, I, for instance, can't even remember the last time I had one. So I'm, you know,
I think you've read my mind, because I was thinking about, you know, we should talk a bit more like general health, and maybe with cervical smears we could talk a bit about sexual health.
Yeah, well, let's cover that next week, because I think that'd be quite interesting, because, you know, like we all go on about cervical smears, and I'm thinking, yeah, well, when did I last have mine? And do you get a letter from your GP? Because I can't remember doing GP, and then when you go to one like private doctor, I haven't had a call from them. So yeah, it's like I don't know where I'm at on it, so I'll have to go and find out.
Yeah,
so
absolutely.
That could be quite
I think
interesting.
That's a good idea.
Yeah.
I think last week was Cervical Cancer Awareness Week, so I think it's a really good
is it? Okay, right, all right. Should we do that next Friday?
Perfect. Over on your channel next week?
We can go whatever. I don't mind. We can all right, we'll do it in turn, shall we? One to another. Okay. We'll do mine next week, and then we'll come back to yours. So I'll put it out there. Anybody out there put questions about cervical smears, cancers, sexual transmitted diseases, and all that, yeah?
Yeah.
All right.
Yeah.
Have an amazing weekend, Dr. Harper. Lovely to see you. Bye.